Hi, how are you? So tonight we are talking about special education. And 1 second, I need to pull up a file and we'll get started. I'm expecting more people, but we'll get started right on time and people can trickle in. Um, so my name is Courtney Schonefeld, and I offer study material and tutoring for a lot of different TExES exams, including the core subjects, the STR, ESL, and bilingual supplemental, BTLPT, and LOTE, special ed. Um, so tonight we're talking about special ed, but I wanted you to know I do all of those in case you need help with other tests too. And hopefully you can see my screen. This is my from my TExES NESIMC website, a screenshot of this, all the tests that I've passed, including special ed, got a 268. I took it in September of almost a year ago, but the test hasn't changed. So it's still the same. And I can definitely give you some tips and strategies. I bought some study material for the special education test, and I was highly dissatisfied with it. I compared it to the free manual at the TExES NESIMC website. And I noticed that it was not similar. Like sometimes they would mention the competencies, but they didn't really fully address them. So I went to this free manual, right? And then I looked at all of the competencies and these descriptive statements, and it wasn't that similar. So I didn't end up using the study material that I bought. Instead, I did my own research, right? So I would read this and then I'd look up information about disabilities, multiple disabilities, eligibility categories, right? And compile the information. And that's how I was able to come up with my own study guide that is closely aligned to the competencies. And another thing I did that really helped me was I looked at all of the sample questions in this free manual, right? And I read all of them and I read all of the answer choices too, to learn why the answers were right and why the other ones were wrong. Because sometimes you can learn even from the answer choices that are wrong. So that helped me a lot. But tonight I thought we would talk about competency one, because I designed this presentation to work for both the 161 and the 163. And in case you're wondering what the difference is, the 161, it has math and English language arts on it, right? The 163 is just a supplemental test. There's no math or English language arts on it, but the rest of the competencies are the same. So that's why what I'm covering tonight is on both exams. So if you're taking the 163, my 161 course will help you. You can just skip the English language arts and math section, right? So competency one is on teaching students with disabilities. And we're first talking about traits of students with disabilities. Now, I'm a little bit different than a lot of the big companies that offer study material, because I've noticed that they include a lot of information and it's good information, but a lot of it's not on the test. And I try to include only what you need to know on the test, right? So we could go into tons of detail about these different disabilities, but I don't do that. I save you time. So we have intellectual disability, which used to be called mental retardation. Now they call it ID. Hearing impairment, including deafness, speech or language impairment, visual impairment, serious emotional disturbance, orthopedic impairment, autism, and TBI, traumatic brain injury. Intellectual disability, according to IDEA, which we'll talk about, I talk about a lot in my course, a student with an intellectual disability has significantly sub-average general intellectual functioning. According to IDEA, students with emotional disturbance demonstrate one or more of the following traits over a long period of time that adversely affects their educational performance. Right, so they have an inability to learn that is not explained by health, sensory, or intellectual factors. They have an inability to develop or maintain interpersonal relationships with peers and teachers. They show inappropriate behavior or feelings under normal circumstances. They show a general mood of depression or unhappiness. They develop physical symptoms or fears related to personal or school problems. So they don't have to have all of these, right? Emotional disturbance includes schizophrenia, a brain disorder that can cause hallucinations and delusions. But it does not apply to those that are socially maladjusted, right? So it's not just being socially maladjusted. Autism. Autism is a developmental disability significantly affecting verbal and nonverbal communication and social interaction, generally evident before age 3, that adversely affects the child's educational performance. Some other characteristics are engagement in repetitive activities and stereotyped movements, resistance to environmental change, or change in daily routines and unusual responses to sensory experiences. That's from IDEA. TBI, traumatic brain injury. That's an acquired injury caused by an external physical force, causes functional disability or psychosocial impairment or both. These impairments adversely affect a student's educational performance. TBI includes open and closed head injuries that result in impairments in one or more areas. Cognition, language, memory, attention, reasoning, abstract thinking, judgment, problem solving, sensory, perceptual, and motor abilities, psychosocial behavior, physical functions, and speech. According to IDEA, developmental delay only includes children between the ages of 3 and 9. This includes delays in physical development, cognitive development, communication development, social or emotional development, and adaptive development, learning to cope with everyday life. Students with learning disabilities can learn grade level content, but they may need accommodations, right? Their IEP will have their list of accommodations and modifications. If a student is struggling with basic math facts, instead of giving them a calculator, give them a pocket-sized chart for reference. This will help them learn and still perform some operations. Needs of those with disabilities and levels of support. So for intellectual disability, help them with adaptive skills or skills they need to live and work in the community. They benefit from concrete activities. They cannot perform grade level tasks. If they have a hearing impairment, they'll need hearing aids, assistive listening devices, captioned media, etc. If they have a speech or language impairment, they need speech therapy, more time to respond to questions, modeling of correct language production, articulatory feedback, which is the feeling the position of the tongue and or lips when making the sound, right? So giving them feedback on where to place their tongue. Another example is helping them figure out if the sound is voiced or not, right? So for example, is voiceless and is voiced. Visual impairment, they may need glasses or contacts, materials in large print, tactile graphics, audio materials. If they have a serious emotional disturbance, they need specific praise and positive behavior charts. If they have an orthopedic impairment, they may need adjustable desks, walkers, wheelchairs, and computers with modified keyboards. If they have autism, they can benefit from sensory strategies, earbuds or music, extra space to avoid being bumped, and alternative seating like wobble chairs, and a calming corner. And if they have TBI, they may need additional time to take tests, extra extended breaks, audio lectures, reduced amounts of work, and oral examinations. Now let's talk about ADHD, attention deficit hyperactivity disorder. They may have a short attention span, be hyperactive or impulsive. It is suspected that the neurotransmitter activity is impaired in the frontal cortex. If they have ODD, oppositional defiant disorder, they may be easily angered, have tantrums, argue frequently, disobey rules, try to aggravate others on purpose or appear to, and have low self-esteem. This is often genetic, and a relative often has a mood disorder. So they might not have the same disorder, but they have some type of disorder in the family. Conduct disorder. The TExES manual talks about this, and it says that they are older students that often violate the rights of others. They demonstrate extreme antisocial and aggressive behavior. Anxiety disorder. They have irrational fears on a consistent basis. Anxiety is not fully understood, but it does have a genetic component. Then we have intermittent explosive disorder. They have explosive reactions and often overreact to situations. The cause is not known, but it may be genetic or learned. Behavioral trait disorders, traits, and explanations. So for emotional behavioral disorders, This includes a variety of conditions, so not just one, that affect learning, behavioral health, and functioning. They may have learning problems, difficulty making friends, inappropriate behaviors, depression, and fears. Risk factors include traumatic experiences and a family history of these disorders. Learning. Students without learning difficulties will benefit from a variety of activities, including visual, auditory, and kinesthetic. Students with learning difficulties will also benefit from these activities, but will often require extra support and accommodations. They may need more time for assignments, help with organization, assistance taking notes, a word bank, or more oral explanations. Piaget's stages of cognitive development. Hopefully this sounds familiar. If you took the core subjects test, you would have learned this. So stage 1 is the sensory motor stage, birth to 2 years old. They learn by putting everything in their mouth. They learn from the senses. They're beginning to understand object permanence, that even if something is hidden, it still exists. Then we have the pre-operation stage from 2 to 7 years old. They're egocentric. They can only understand things from their point of view. They're slowly starting to decenter. They believe in animism. That means they think everything is alive or has the traits of living beings. And they are in a state of moral realism, thinking everyone has the same values as they do. Stage 3 is the concrete operation stage, usually 7 to 11 years old. They need something concrete to be able to think about it, like a manipulative. They start to understand conservation, or the idea that a tall, skinny glass of 8 ounces of water is the same as a short, wide glass of 8 ounces of water. So I always think of the con and concrete and the con and conservation, that they go together. And then we have the formal operation stage from 11 to 12 or up to 16 years of age and beyond. And here they can make a hypothesis and come up with solutions, right? Develop a theory. These are some disabilities that affect human development. So you've probably heard of fetal alcohol syndrome. When the fetus is exposed to alcohol, they can be born with fetal alcohol syndrome, which can cause an intellectual disability. Students with an intellectual disability cannot perform grade level tasks. Down syndrome, they're born with an extra chromosome affecting their brain and body development. They usually take longer to learn to speak, have a flattened face, and almond-shaped eyes. They may also have hearing and heart problems. Fragile X syndrome, this is a genetic condition that causes intellectual disability. They often take longer for developmental milestones like sitting and walking. They may also have social and behavioral problems. Cerebral palsy, or some people say cerebral palsy, a condition that affects balance, movement, and posture. It is caused by abnormal brain development or by brain damage. They may have intellectual disability, seizures, vision problems, speech problems, joint problems, and changes in their spine. They might also have stiff muscles, poor balance, and uncontrolled movements. Spina bifida is a birth defect in which the spinal column is not properly formed. It has a genetic component. They often have bladder problems, weakness, and loss of sensation, can't move their legs well, and have learning difficulties. A form of treatment that they mention in the test sometimes on test questions is a shunt, and it's a tube that drains cerebrospinal fluid and relieves pressure. If a student is struggling with a motor impairment, he or she may make involuntary hand movements. They ask stuff like that too. All right, cultural and environmental influences. So I try to stay away from stereotypes, but they ask about cultural and environmental influences. So we know some cultures generally place more emphasis on higher education, and they have literacy-rich homes, right? And some cultures, that's not as common. But a lot of times this could be socioeconomic, not cultural. If they're struggling to pay the bills, they probably don't have money to buy books, right? Normal, delayed, and disordered communication patterns. If they're experiencing normal development, in pre-K, you'll understand most of what they say. And in kindergarten, almost everything they say. They're using longer sentences. If speech is delayed, they will use shorter phrases and may not be intelligible. There are different communication disorders. Speech disorder, they may have problems with articulation, fluency, or voice. Language disorder, they may have impaired comprehension and use of language like phonology, morphology, syntax, pragmatics, and semantics. And then these are some medical conditions that they ask about on the test. Diabetes, right? They have trouble regulating their blood sugar. And if they take insulin and forget to eat, they can go into insulin shock, right? They start trembling and get irritable. If they have epilepsy, they have seizures, they have to take medicine for that. If they have a heart condition, they might have shortness of breath, chest pain, rapid heart rate, etc. If they have spina bifida, they will usually need surgery and may require that shunt we talked about. Complications after surgery, they may need to take medicine or use a catheter to drain urine. And then CPR, when someone is not breathing or their heart has stopped, they need CPR. So that concludes the competency one content. But now what we can do is look at some sample questions, right? So in my course, you'll definitely learn a lot from the slideshow, but you'll also learn from the questions, and it makes it interactive. So we have a second grade student struggles with telling time, counting by twos, memorizing addition and subtraction facts, and other concepts. What is likely the cause? So which one involves math? Dysgraphia involves writing. Dyslexia is reading. Dyscalculia is math. And then ADHD, we already talked about that. So if these questions are not specifically addressed in the presentation, you'll learn it from the questions to make it interactive, right? So let's get it wrong on purpose. And then you'll see when you get it wrong, it'll explain to you the right answer, right? A first grade student is struggling to add numbers that add up to 10. Which of the following should the teacher do? She should give the student flashcards to practice each night at home and tie it to a tangible reward. Well, that sounds good, but the correct answer is not usually something that they're going to do at home. She should give weekly timed assessments over math facts. Well, they need some support, right? So that's probably not it. She should provide a small reference chart with math facts. She should allow the student to use a calculator. We never want to do that. That's a last resort. So the reference chart will help them gain independence and start to learn it. An 8-year-old student, well, there's a glitch with this one. I'll have to fix that. Let me just get that one wrong and I'll skip it. So 3 has a glitch. This is a brand new course. A first grade student experiences learning difficulties and occasional seizures. He also has a long face, flat feet, and a prominent forehead. Right? So we learned a little bit about these disorders, right? So Fragile X syndrome, they have those features very often. A third grade student often resists authority and rebels. The student's behavior is indicative of which of the following, right? So conduct disorder, ODD, ADHD, bipolar. Well, we remember conduct disorder, it said that they violate the rights of others and they're usually older, so that's not it. Definitely this is traits of ODD. It's not necessarily ADD. Not all kids with ADD resist authority and rebel. And bipolar would be if they have extreme highs and extreme lows, right? A first grade student has type 1 diabetes. He starts shaking and sweating and feels dizzy. He recently ate a snack. What is the likely cause? His blood sugar is too high. His blood sugar is too low. He is experiencing insulin shock. He has a virus. So if his blood sugar was high, he'd have other symptoms like urinating more frequently, things like that. His blood sugar is low if he's shaking and sweating, but that could also be insulin shock. So how do we know which one it is? Well, he just ate a snack. Insulin shock happens if you forget to eat. So he just ate, he probably just didn't eat enough carbohydrates. And I don't think he has a virus. Which 2 of the following are common to students with both autism and visual impairment? Engaging in repetitive actions, well, that's definitely autism, but not necessarily a visual impairment. Staring at lights, they might both do that. Squinting, that would be visual impairment, but not autism, and lack of eye contact. So see how I looked at all 4 options and chose the ones that are right. So this is just a small sample. You can see my course has all of the competencies you need to know, and it has a presentation for each one and a full-length quiz for each one. So it adds up to a full-length test with 150 questions. So a ton of questions in here. Legislation and history, you learn the legislation and history you need to know, all of the different stuff you have to know, evaluation, planning, assistive technology. Some of the competencies are shorter than others. The first one's kind of on the longer side. And I recommend you study for at least a few weeks, really going through this information carefully and not just one time, but a couple of times. So that's about all I have. Like, I mean, I have way more, but since this is just a little mini session, I want to save time for questions or comments. Do you have any?
No, I don't think I have any. I'm taking my test October 14th, and it's the EC through 6
Oh,
test. I've already passed my SPED test.
oh, good, good. Well, hopefully this reinforced what you learned. And I do have some great study material for the course subjects if you don't like the study material that you have.
Okay,
Let me just turn off the recording so we can keep chatting.
sure.
I don't want to, I'm going to upload this recording. I don't know why it's not letting me stop recording. There we go. Stop recording.